Hello and welcome to this training designed to educate community members on responding to an opioid overdose and how naloxone can be used to intervene and save a life, provided to you by the Berry County Substance Abuse Task Force. This brief training will provide you with information on what naloxone is, what signs of an opioid overdose look like, and how to use naloxone to respond to an opioid overdose. This training is provided in partnership with Southwest Michigan Behavioral Health and the COPE Network of Kalamazoo. Naloxone is a prescription medication that specifically works to reverse and address overdoses caused by opioids. Opioids are a class of drugs that include the illegal drug heroin, synthetic opioids such as fentanyl, and prescription pain relievers such as oxycodone, hydrocodone, codeine, morphine, and many others. These substances, whether used illegally or with a prescription, bind to specific brain receptors and act as depressants on the central nervous system, leading to a decrease in someone's breathing and heart rate, causing oxygen levels to fall throughout the body, including the brain. When someone consumes more of an opioid than their body can handle, it causes an overdose, leading to the slowing and stopping of their breathing and sometimes death. When naloxone is introduced to the system, it acts as a pure opioid antagonist and reverses and blocks the effects of the opioids, quickly restoring someone's breathing rate back to normal so sufficient oxygen can be delivered to the brain and body again. Naloxone was first approved by the Food and Drug Administration in 1971 for first responders and has proven to be a safe and effective medication for treating opioid overdoses, with reports of allergic reactions being extremely rare. Each kit includes a pair of non-latex gloves, a rescue breathing shield, and 2 doses of intranasal naloxone. Each kit also contains resources that can refer people to recovery and support services in the area. Should you ever have to use your kit, there is also information on who to contact to report that use to help better track how naloxone is being used across Michigan. There are several signs that someone may be experiencing an opioid overdose. These include small or constricted pupils, slowed or slurred speech, sleepy or coming in and out of consciousness, blue lips, and loud snoring or gurgling sounds. The main sign of an opioid overdose is that a person is unresponsive. If someone is able to talk or you are able to get their attention, they are not overdosing yet. They should continue to be monitored to ensure that naloxone can be used and 911 called if they were to become unresponsive. To understand the steps for how to administer naloxone in an overdose situation, we will use the 3 A's, standing for assess, administer, and aftercare. First, assess the situation. Determine if they are overdosing and unresponsive by performing a sternal rub. Make a fist with your hand and rub your knuckles down their sternum with enough pressure to make it uncomfortable. If this does not cause them to respond, you can assume they are unresponsive and move forward in the following steps. An overdose is a medical emergency that requires medical intervention, so be sure to call 911 as soon as possible. After determining that this person may be overdosing, it's time for the second of our 3 A's with administer naloxone. With the individual on their back, insert the nozzle all the way into one nostril, then place your thumb on the plunger and press until the medicine is fully dispensed. After administering naloxone, perform rescue breathing. This does not require chest compressions and ensures that enough oxygen reaches the brain until the naloxone takes effect. Using the face shield, line the diagram on the shield up with the person's face so the filter lays on top of their mouth. Put a hand on their forehead, tilt the chin up, and perform 2 quick breaths, and then do 1 full breath every 5 seconds. Continue rescue breathing for 3 to 5 minutes. If the individual is not responsive after this time, administer the second naloxone dose in their opposite nostril, and then resume rescue breathing. The third A is for aftercare. It is important to continue to evaluate the individual while waiting for emergency medical attention. It is possible they could slip back into an overdose because naloxone does not stay in their system as long as opioids like heroin and methadone do. That is why it's important to seek medical attention and stay with the person until they are able to get care. If you run into a situation where you don't have your naloxone kit with you and you suspect someone is overdosing, you can still help. Call 911 and perform rescue breathing to ensure they're getting enough oxygen to their brain while you wait for emergency services. Store your kit in a room temperature area, keeping it out of direct sunlight. If your kit does get exposed to a temperature extreme, such as in a car on a hot or cold day, research shows that the naloxone is still effective in reversing overdoses, so you can and should still use this kit in an overdose situation. Your naloxone kit does have a recommended manufacturer expiration date that can be found on its packaging. If you suspect someone is overdosing and all you have is an expired kit, you should still use it. The overdose reversal effectiveness decreases minimally after its expiration date, and there's no evidence that this causes adverse side effects. When your naloxone kit does expire, you should replace it. Please contact the Barry County Substance Abuse Task Force to get your free replacement kit. Naloxone is a prescription medication that does not identify a specific patient when it is given out. This allows you to legally administer this medication to another person who is not identified on the packaging. The Good Samaritan Law provides legal protection to allow you to administer naloxone as a way to provide reasonable assistance to someone you believe is overdosing. Remember your 3 A's. Assess the situation and determine if the person is unresponsive and may be overdosing. Administer naloxone by dispensing the nasal naloxone spray into their nostril and performing rescue breathing. Provide aftercare by staying with them until help arrives. If you suspect that someone is overdosing, administering naloxone is a safe and effective way to help save their life. So, when in doubt, try it out. Thank you for your time and investment in this important topic. Please return to the Google Form page to provide the necessary information to receive your own free naloxone kit.